Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Muhammad Farid, clinical auditor from Al-Konfoda region. This is the first presentation about venous thromboembolism. At start, we have to discuss some facts about venous thromboembolism to know the magnitude of the problem. VTE is ranging from asymptomatic DVT to massive pulmonary embolism. VTE is a source of significant morbidity and mortality in hospitalized patients. VTE is the fifth cause of death in the United States. VTE causes more than 500,000 deaths annually in Europe. Morbidities from VTE are ranging from recurrent VTE, post-thrombotic syndrome, venous ulceration, chronic thromboembolic pulmonary hypertension. Again, some facts about the venous thromboembolism. There is a high incidence of VTE in all countries. VTE is a leading cause of death. The burden of the disease is very high. The majority of VTE is related to recent hospital admission with known medical or surgical condition. Appropriate thromboprophylaxis in and out of hospital can reduce the burden of the disease, and VTE is a preventable public health crisis. Also, 2/3 of VTE are hospital acquired, so it's a nosocomial disease. 70% of patients with pulmonary embolism will die within the first hour, and there is a study shows the gap between what should happen to VTE and what's happening already. We have 59% of at-risk surgical patients receive guideline recommended prophylaxis, only around 60% receiving the prophylaxis according to the guideline. This is for surgical patient, and 40% only for medical patient receiving the guideline recommended prophylaxis. So we have a gap here. We have to try to fill this gap. MOH tried to do a lot for this program, so they established the National VTE Prevention Program. This program have some objectives. We will discuss some of them. Increase effective risk assessment for hospitalized patients. Increase using appropriate VTE prophylaxis in at-risk patients. And of course, we will reduce the incidence of hospital-acquired VTE if we do so. We have to align our efforts with CBAHI standard, as in PC 26 is talking about VTE assessment and prophylaxis. And now we have to discuss some activities for the National VTE Prevention Program. They established the main VTE committee in MOH that oversees the whole VTE activities in all areas. They supplied all areas with the VTE package, and this package contains the clinical practice guideline. We will mention some of them: prevention of venous thrombosis in general abdominal, pelvic surgery, and major orthopedic surgery. Clinical practice guideline on prevention of venous thromboembolism in patients with stroke. Prophylaxis of VTE in medical patients and long distance travelers. Clinical practice guideline on the diagnosis of suspected first-degree vein thrombosis of lower extremity. All those clinical practice guidelines coming from well-known references like ACCP, which is the American College of Chest Physician, the 12th edition, and ROCOG, which is the Royal College of Obstetricians and Gynecologists. They also supplied all areas with all forms needed for VTE, like assessment form and reporting form. Assessment form, this is assessment form for adult cases, for prenatal cases, and even postnatal cases. They also supplied all areas with the VTE policies for adult, for prenatal, for postnatal cases. They also made many workshops and meetings centrally in Riyadh and in almost areas all over the kingdom. They made a hotline to answer any question at any time. Many thanks to Dr. Anas and to Dr. Saleh. They made a link to submit VTE assessment and scoring and prophylaxis for each hospital all over the kingdom. They supplied all areas with the dashboard to follow up all areas monthly, and even we can use the dashboard locally to develop our local dashboard. They also supplied us with the VTE strategy assessment tool to ensure that we are measuring the current situation and to do the required continuous improvement. It was the first presentation. Until you meet you again in the next presentation. Thank you.